Hey guys, welcome back to my channel. My name is Morgan and I'm obsessed with everything skincare related and beauty. Also, you guys, I am diagnosed with fibromyalgia and post-infectious disease syndrome if you're new here. You guys, if you are new here, I am always making update videos and talking about having post-viral fatigue syndrome and what I'm going through, and I have a whole playlist on it, so please go find that playlist and watch all those videos if you want to know more information. I know post-viral fatigue syndrome is kind of getting some more and more recognition these days for the things that are going around in the world, because you know what? It's about time. That's all I have to say about this, because this illness is no joke, and adds a plethora of so many other issues, and there is so little known about post-viral fatigue syndrome. It's actually scary, and they're like trying to tell people that it's like okay to like get pregnant and stuff on this, and it's like they don't really know, and I just feel like it's really freaking dangerous having a chronic illness that doctors don't know anything about, don't have a cure, don't have formal treatment plans, don't know how to prescribe medications for it, don't even know how to diagnose it without sending you to 10 other specialists. And you know what? It is a show and a half to have it. This video is an update on what is going on with me. You guys, I'm drinking tea tonight. It's pouring outside and I'm kind of just snuggled up on my chair doing YouTube videos. I'm drinking tea out of this adorable teapot and I just love it, and I'm drinking it out of my cup from Lenox. So just wanted to share that with you guys. This pillow is from West Elm. You know what? I'm gonna link everything that's here below so you guys could just know what it is and where to buy it. All right, so the reason why I'm coming on here is for two reasons. Three reasons, depending on how emotional I want to get and how much I want to share today. The first reason is I'm going back to the Mayo Clinic for treatment. You guys, I'm not sure how much I've talked about Mayo Clinic as a hospital as a whole for post-viral fatigue syndrome, fibromyalgia, chronic fatigue. They call it it's called central sensitization. That's their diagnosis for what we have. It's kind of like the broad word for everything that we have. We're just a little different because our issues were brought on by a virus. We all have that in common, where our lives were completely normal. At least I can say for myself, my life was completely normal. I was a completely functioning human being. I had friends, I was active, I had a full-time job, and I was just a completely different person actively. Then I got a really bad virus. I was just really impacted by a virus called RSV, respiratory syncytial virus, and it really just changed my life. And after 6 months, so what I want to say is it's normal to have these conditions, these post-viral symptoms for up to 6 months. If you're not better by the 6-month marker and you're still experiencing all these issues that were from your virus, or new things that just keep getting brought on as a result of your post-viral fatigue, that's when it comes post-viral fatigue syndrome. So it's not post-viral fatigue syndrome until it's 6 months old. Hopefully you don't make it to that marker, because this is a bitch to deal with. Unfortunately, I made it to that marker and I still have it, and it's been over a year, and I'm going back to Mayo Clinic for my second visit. I went to Mayo Clinic in June of 2019 as a last attempt, because at the time my local doctors were really just juggling me around and ping-ponging me from office to office, seeing every specialist I can get my hands on, and kind of like not knowing what to do with me. And I have been through so many tests, so many treatments and medications, and just traveling and for medical treatment, and nobody knew what to do with me. Nobody knew what to do with me. Nobody could, I would say, listen guys, I think I read something about post-viral fatigue syndrome, and they would agree that I fit the criteria for it, but none of them were confident enough to say, you have post-viral fatigue syndrome. Want to know why? Because they just didn't know enough about it. So I finally just said, screw it, I'm going to Mayo Clinic. I hear they're the best medical facility, and I need the best because I'm not getting the best where I live. In the meantime, I'm suffering, I'm struggling, I lost my job, you know, a lot of things were happening to me, and I didn't really have any more time to deal with doctors who didn't know what the hell they were doing with me. So I went to Mayo Clinic, and when I went to Mayo Clinic for the first time in my illness history, I felt like I was believed and I was understood, okay? A lot of the doctors don't want to believe you. They push it off to people as it being a psychological issue, which is insane because they've seen you have a bad virus. Like, my doctor was seeing me at least once a week, as well as routine blood work, and like was still like, maybe it's psychological, but like I was normal before it, and then he was seeing me every week as a result of the virus and me just declining, and then he just tried saying it was psychological, and it like I think back at that, I'm like, that made no sense because he was my doctor for 2 years prior. I went to Mayo Clinic. I was totally understood. I saw a bunch of their specialists. They all took their time with me. Gorgeous, gorgeous facility. Their main, I think, flagship hospital is in Minnesota. I chose to go to the Jacksonville one, Jacksonville, Florida, because it's closer to me. I'm in Pennsylvania, and I wanted to go to Florida, and you know, I may as well be by a beach, you know. And I'll tell you what, I never felt more confident and more happy than I did when I walked out of Mayo Clinic. For the first time in my post-viral fatigue syndrome history, I talked to people about what was wrong with me with confidence. When my disability specialist would call me, and my work would call me, I had more confidence in that I knew a little more what's going on with me, and Mayo Clinic provided that for me. And ever since I left Mayo Clinic, they wanted me to stay because they wanted to put me through. Once they were able to get me to all these specialists and do an obscene amount of blood work and an obscene amount of testing, that's when you diagnose post-viral fatigue syndrome by exclusion, because post-viral fatigue syndrome is not shown on a test. So they have to make sure there's no underlying cause, such as anything else, like Lyme disease or anything like that, before they could say, yes, you have post-viral fatigue syndrome. You guys, it is kind of a hard diagnosis to get because along all those tests, usually there's underlying factors that made you more susceptible to post-viral fatigue syndrome. However, my situation, there was literally nothing that was making me, honestly, it was such a phenomenon, but was it? Then I asked myself, was it really a phenomenon? Or is it more common than people think? And I have a feeling it is. And I have a feeling a lot of people are behind closed doors struggling and suffering and too embarrassed to say and get help because doctors won't believe them. Friends and family don't believe them. They're judged, they're ridiculed because it's an invisible disease, visible illness. It's not, it's an invisible syndrome, illness, chronic illness. What is it? What is it really? What is it really that we have? Because for me, my post-viral fatigue syndrome, along with having it, then also developed into fibromyalgia. I did not have fibromyalgia before I got post-viral fatigue syndrome. Let me just say that. My body just kind of started breaking down. What happened was I was sick for so long that over time my body just was sick. It just had this virus just reactivating and it wore my body down. And as a result, my body really only functions at like 30%. I don't even have half my function back. And from always functioning at 30%, your body is tired. You don't get enough sleep at night. You're in pain all the time. You have all this brain fog because you're so tired, because you're chronically tired. I mean, it's just a plethora of issues. So now, after I left Mayo Clinic, I felt great. I felt like I was finally diagnosed. My local doctors took me serious because once Mayo Clinic finally said, okay, she has this, you have to treat her for it. Now, it's kind of up to your PCPs to then figure out how to treat it. At least they could do that, right? The diagnosis part is hard enough. Now it's Now you guys got to figure out how to treat us, right? And let me tell you something, good luck with that, all right? Good luck with that. Anyway, so I'm finally going back to Mayo Clinic. And why am I going back to Mayo Clinic? Because now that they've diagnosed me, they have something called it's a class where they teach you from their pain clinic, I believe, how to manage life with these conditions. Now, I read a really, really fantastic article. I'm gonna link it below. I thought it was amazing what this girl wrote. And it was titled something like, Having an Illness That Doctors Can't Diagnose. And she just went through everything that I went through. Like, it was such a relatable article, and it was all about how we have these illnesses. It's not directly related to post-viral fatigue syndrome, of course, because what is post-viral? No one knows what it is, girl. No one knows what it is but us, the ones who have it. She does speak on having an illness that is invisible, that no one even believes that you have. Like if you have what we have, we look normal some days. Some days we're functioning just fine. Well, wait, no, there's never a damn functioning just fine. Forget it, but it looks like I am. And a lot of people don't have patience for it, because it's like, you're disabled, right? You have this terrible condition that totally disables you, but there's nothing showing, there's no test for it. There's no test to prove that you have these situations, these conditions. So there's nothing to show for it. There's no real name for it. Some people call it post-viral fatigue syndrome. Some people call it post-infectious disease syndrome. Some people think it's a neurological disorder. Some people think it's an autoimmune disease. Some people think it's a psychological issue. Some people think, I don't even know what they think anymore, girl. But what I do know is it's very physical, and the only psychological aspect of it is having the damn illness itself and functioning with it. That's the psychological part. Being strong enough to function with this nonsense. It's very easy to become bedridden and depressed, let me tell you. So, which is why I started this channel, actually. This channel is the reason that this channel has really given me purpose, and that is why I'm so passionate. This channel and skincare really helped me get through it, you guys, and my subscribers. I mean it. So moving on, I'm going back to Mayo Clinic. It's a beautiful facility. It's like a little vacation. That's what I tell myself. And it's beautiful. I don't mind going to the Mayo Clinic. It's right by Jacksonville Beach, and it's a nice trip. I will not get in the air because I'm not, even though I know it's post-viral fatigue syndrome, I don't trust my body, because I'll tell you what, the feelings that you get with having these conditions, the different sick feelings that you get, the headaches, the weird pains, the weird nausea, the weird confusion, the weird clammy sweats that I get, the pain, the confusion, I'm sorry, I'm still uncomfortable, even though I feel like I may be managing as good as I could right now with what I got. I don't feel comfortable enough to get in the air and fly. Sorry, I just don't. So my husband and I, it's a 15-hour drive. We're gonna drive down there. He's gonna drive me. So yeah, you know what, you guys, I'm gonna do my best. I wanna take you guys along with me the best that I can. I don't wanna be disrespectful in a hospital though. So if I'm not getting good hospital footage, please excuse it. There is a lot of people that have waited a very long time to go to that hospital and have some very, very severe illnesses that obviously I need to be respectful of wholeheartedly. There's a lot of very sick people that come to this hospital specifically for these doctors' expertise. So I'm gonna be, and of course, if I'm talking to these doctors, having a camera in the room, I'm probably not going to do that, but I'm going to do what I feel comfortable doing. But of course, I'm going to let you guys know of everything that's going on, and hopefully I can even get a little more details on what's going on with today's big issue and post-viral fatigue syndrome itself. So I'm hoping to get a lot here for you guys, because I know a lot of us are struggling because not a lot of people are getting totally better after what's going on, and there's very few people talking about it. So I'm gonna do my best to get what I can for you guys. This is my journey, this is my life. Why not film it? Why not share it? Why not educate you guys? I love you guys. Stay safe, stay healthy. I'm sending calm hugs and warm hugs to you. Please read, if you haven't, I'm really gonna link this video, or I'm gonna link this thing below. I want you guys to read it. Read it, and I promise you, you won't feel alone, and it's gonna make a lot of sense, and I want you guys to be comforted in that. So I will be in touch. See you guys soon. Bye.